Okay. Welcome, everybody. Thank you so much for being here today. This is our second community of practice meeting focused on mental health. And I'm Lily with the Kentucky Student Success Collaborative. And I just wanted to kind of welcome everybody and give you one more time kind of this is the big picture of what we're trying to do here together. So as we all know, mental health is one of the most important critical success factors for our students. And it is a huge issue on all of our campuses, from our 2-year to our 4-year, our publics and our privates. I mean, we share this issue in common. And so what we're trying to do through a community of practice, over this particular academic year, we're having 4 community of practice meetings to hopefully kind of set the stage, get to know one another, share our challenges, what we're trying out, what's working, what we're considering, sharing these different ideas of how we are currently dealing with student mental health and well-being on our campuses, with the goal that we will be able to come together in May for a day-long convening to really think about a strategy for our state. What do we want to do together that really would help us all as we're moving forward on these common priorities? So there are 2 more meetings that are scheduled for the spring semester. I do hope that you have those registration links and that they are already on your calendar. We can put them in the chat. Just to make sure, in case there's anybody new here today, these community of practice conversations are open to everyone. So faculty, staff, whether or not you're the director of the counseling center. So please do feel free to share widely with other campus stakeholders and champions who are very engaged in this mental health work with you on your campuses. And then, as I mentioned, I believe that we're saving the date of May 20th for a convening in Frankfurt at the CPE offices. We'll have Jed come, they will be there with us to really give us a snapshot of some of the Healthy Mind survey data that if your campus is currently participating in the Jed campus program, we'll have some good Kentucky data to share out at the aggregate level, of course. On how our students are faring and what some of the biggest issues are and what we think we can do about it together. So welcome. I really am excited to just kind of listen to the conversation, and I will turn it over to you, Erica.
Thanks, Lily, and thanks, Nan, and thanks, Phyllis Viron, for helping. Thanks for being here, everyone, and I'll get started. And yes, invite your colleagues to these. It's great information and resources for you all and your students. So if you don't mind, in the chat, and we'll have a lot of time to connect today, in the chat, just share your name, your role, your years, and your role in your institution, just so we start to get to know folks, and just do that as we take on the day. So today's agenda, so we did the welcome. We're going to go through JED's comprehensive approach, but really focused on 3 of our domain areas, which are strategic planning. We'll then move to life skills, connectedness. We'll do reflection, share out, and then closing remarks. And I think what will be really great about today is you'll do some independent work, just sort of like thinking, maybe turning off your video, and then you'll get to meet colleagues and actually talk about it in breakout rooms. So just a reminder, the JED Foundation is a nonprofit. We are based in New York, but our staff are really all over the country, and we work to protect emotional health and prevent suicide for our nation's teens and young adults. Jed was the name of the founder's son who died by suicide. Jed died by suicide in 1998, and the foundation started in 2000. So this is our comprehensive approach. We ground all of our work with our communities, stakeholders, organizations, and specifically schools, high schools, districts, and colleges. I'm thinking about how does this model translate into public health systems, policies, procedures, and programmatic efforts. And we look at what's existing, what are the strengths that are happening on campuses, and where are areas to improve, which we all know certainly needs to happen in this sort of post-pandemic world. And we just know it's on the top of our minds for our senior leaderships, for our families, and most of all, our students are struggling, and we need to be able to help them on the ground through our classroom and through our programming and through the work that you're all doing to support one another as well. So we're going to start with strategic planning. And I know some of you all are in the JED campus program, really focused on and thinking about strategic planning more broadly. And others, maybe this is the first time you're kind of hearing about it. So I'm mindful of that, but I just really, what happened? Okay. I want to talk about, this pillar, which is when you look at our wheel, that's, kind of around the wheel. It looks at sort of how do we all pull it all together. So many of you have heard of strategic plans. You might be thinking, oh no, another strategic plan. But when we think of strategic planning, it's an active and dynamic document, but it's taking practice into action. It's crucial, especially for mental health and substance use prevention programs in schools. And it depends on our success depends on broad ownership. It's a shared commitment to common goals. We hope there's a mutual understanding about sort of what's listed, what's recognized, what do we have to aim. Some of them are by year, some of them are sort of a 5-year strategic plan that exists at the institutional level. They involve upper lead administration. Of course, we want student involvement and buy-in as well. It's a dynamic document. It's regularly reviewed and updated. It addresses both national and campus specific issues, utilizes relevant data, defining strategies, and involves campus stakeholders. And it's enhanced, I think, because when we think about how JED sort of interweaves with schools and communities, we want to integrate mental health strategic planning. We want to integrate connectedness and belonging. We want to know what are the stats among young people and how are we thinking about broadening this approach and where we need to kind of focus our efforts and our funding and our energy. So, and you all may already know all this, but some schools have institutional. Many have institutional strategic plans, and others have various strategic plans within sort of departments on campus or just sort of like by sort of arena area, whatever it may be. So take a moment. You can turn off your video, find a piece of paper, whatever it is you need to do. But I'm going to ask you to go on a little scavenger hunt and look at if your college has a campus-wide institutional strategic plan. How did you find it? How easy was it to find? Did you Google it? Did you go through your search engine? Tell us if it mentions mental health, wellness, or belonging. Maybe look at how many times. How do you feel when you read it? What would you change? What would you add? And then we're going to come back and share out. So we'll give about, 5 to 7 minutes if need be, just to kind of do some independent work, and then we'll come back. And if you have any questions, you can say it out loud or in the chat. Thank you. Okay, we have about a minute left. I'll invite you to turn back your cameras when you're all set, but keep on looking through your websites and jotting down some notes. And thanking everyone for participating. Okay. So you all can keep doing this, of course, but I just want to invite folks to come back. Any brave souls willing to share a little bit about what you found? Anything that's coming up for you when you read through your university strategic plan? Take a few volunteers.
I can volunteer. This is Ann Goodwin at Center College. So we are a JED campus and have done a bunch of work around this. So a lot comes up for me. We have a strategic plan for 2020 to 2025, and community wellness is one of our 3 strategic priorities. We worked really hard to get that as a strategic priority. It was, I don't know. I think that from working with JED, they say 1 click away is what we want for things to be easy. It was in the search bar, which is what my communications team tells me is what students use, but it was 2 clicks to find it. And I kind of had to guess and know higher ed to know the right section to look in, but found it with 2 clicks. And wellness is all throughout it, but it does not, and we're working on it. I keep having conversations, seeing who I need to talk to, but it does not accurately reflect all the work that's been done. Somebody from a higher up office than me wrote a lot of content, and it's not problematic content. Like, it's all nice well-being stuff, but it's not talking about what's actually happened on our campus and what we're working on and where there's a lot of action. So that's frustrating because I'll run into a colleague from another department or a faculty member who I don't see very much. And they'll be like, oh, wellness is a strategic priority and we're not doing anything there. And I'm like, you're doing so much there. So it's a very important communication tool. So, okay, I'll stop talking. I can talk for a long time about this.
Thanks, Anne, and thanks for noting the 1 click. Yeah, we like to think about 1 to 2 clicks for anyone sort of visiting university and trying to find or access, either resources, mental health, because if it's 3 to 4, you'll lose people and they'll just end up maybe using Google. And then it's like, oh, you created this website and you can't search. But really appreciate that. And good to highlight that there's work that's done on the ground that may not be recognized, and that's something to explore as we work through this. Thanks for sharing. Others?
I could go and give sort of the opposite of what Ann just said. So I'm at Spalding University, and our communication has just not been great lately. We had a strategic plan years ago that did include mental health. Our current one, first of all, I couldn't find it on our website at all, which was not surprising. None of us love our website. So I just Googled it and I did find it there. And the best that we have as far as mental health, I'll have to go back and read it, is under our diversity, equity, and inclusion section that just says we will practice and promote a healthy campus climate. But there is no mention of mental health anywhere in there because they didn't ask any of us during the last strategic planning time. And it doesn't even say when this strategic plan was. I know that it was done a few years ago, but I don't know how long it is going. We are in the search for a new president. So if anyone, has some ideas about that, feel free to send them our way, please. So hopefully we'll get a new strategic plan this next go round that I will be able to be in on. But currently I feel a little pissy about what it says.
Thanks, Allison, for your honesty, and the context matters. New leadership, what it used to say, what it is now, I think, and also where can we adapt and change and be part of the new narrative as well. Thank you.
I'll chime in. So at Bellarmine, it's I guess maybe a little bit between the two. Probably closer to Ann's situation than Allison's. I would say since the us adapting the JED Campus model here, being involved with JED Campus, it has changed the profile of mental health. Although people were talking about it before JED Campus arrived, it was a way of kind of moving forward. And so since that time, I see health and wellness incorporated with the strategic plan. So that's can be easily found on the website. It doesn't specifically mention mental health, but it does talk explicitly about health and wellness. It's also part of the new university marketing campaign to talk about the Bellarmine impact as a way of talking about what all Bellarmine students should experience, and wellness is one of the 4 centerpieces of that. So that's been great. It's been a way of kind of tying our work with what we're supposed to be doing as a campus, because a lot of times I've found in my past that I look for a way to connect counseling center work to the university strategic plan. So it's nice to actually have something particular we can tie it to. So that's been good.
Thank you, Gary, for sharing.
I'm at Murray State, and we have a pretty comprehensive mental health and wellness plan. On the mental health side, we have a mental health counseling facility that provides free access to counseling for our students. We also have one through the we have a counseling program in which we have people in the master's level that are engaging under supervision, that are providing services not only to the campus, the spillover from the mental health, but also to the community, which is a great thing. Now, going beyond just the mental health, there's a very well-developed system in which pretty much all the departments are involved in trying to promote a wellness program, and we're currently working through a QEP program to try and develop, kind of give more access to education and resources to our students. So I'm pretty proud of what we're doing here at Murray State.
Thank you. Any others want to share? And also you can ask questions of your colleagues as well. It's really open. Okay. All right. Well, if you feel like sharing, you're welcome to. We'll keep going, but this is why it's part of the wheel. It's something in writing, something on the website. It's not everything. Obviously, there's so much that's being done on campuses. There's so many people involved in a lot of these initiatives. A lot of changes happen within leadership that kind of derail us. So it's part of the puzzle. But really appreciate everyone sort of trying this out, and I hope it sparks a lot of action, and especially when we come together in May, this could be really a great topic of conversation to revisit and just to continue on about sort of how does this come to life, and who needs to be at the table to continue to be part of it. So thank you, everyone. Okay, we're going to go on to life skills. Okay, so we're going around the wheel. And what do we mean by life skills? It's really equipping our students with how to transition to college, how to live for the first time with a roommate, how to understand how to manage your finances for the first time, maybe, how to communicate, how to prioritize time management or classes or your work schedule and extracurriculars. What does that look like? And where can you find them on your campus, and who's kind of owning it, who's part of, building more? How do you take down the programs that are not working? And why aren't they working? Kind of how to assess that. So this is a long list of the skills and around social emotional skills, resilience that we think of at JED when we're helping schools just navigate like what exists, doing really trying to figure out like where these live. And some of these you may have, and some of these you may wish to have. But also we know, we know these are all really important, and we know that we have missed some of these, especially during the pandemic. And it's how do we get back to there? How do we think anew with some of these programs? I'll even mention like resilience. There's been a lot of interesting conversations happening around resilience. Kind of how do we bounce back, and how do we get people to be talking about and having hard conversations? How do we talk about sort of world events? How do we help students navigate in just troubling times? And that's just one thing that comes to mind when we think about like where is this going, and who's kind of leading the charge here, who's facilitating some of this dialogue. So I'll share this resource, and we were kind of like poking around with some resources from the Higher Ed Assistance Authority. And this is an example. You can see that this sort of money plan, read a pay stub, gives students a sense of like, how do you set financial goals? How do you read a pay stub? How do you understand credit, preventing fraud? Again, a worksheet, something that can be used in and out of the classroom in sort of a working group, in the academic side, student services side, whatever it may be. But this is just, again, one piece of the puzzle that may work, and you may want to expand into sort of or may exist. So just kind of noting the examples that are out there. University of Rochester, they have a NAP guide and map, and they have pods. And of course, we know in COVID, like some people were like, we can't really do this. It's maybe not hygienic. And but I think, again, sleep correlates to positive mental health, right? And just kind of acknowledging and educating about why these exist on campus, what are the facts, what are the statistics, and making healthy decisions and choices. I think we can all sort of get around that. So again, what's happening around life skills? This is one example. So we are going to go into a breakout room right now. We'll do, looks like we'll do breakout rooms, 3 rooms. And we'll go through some of these guiding questions. You'll get a chance to meet your colleagues and talk about moments where your students have asked you for advice regarding life skills, how to build them, how do you feel about supporting them, how did you manage, and what does your school offer, or what do you wish your school offered? I think it's just an open conversation where you all can just share some stories. So Nan, whenever you're ready. And we will put the prompts also in the chat as well. See you soon.
Nan, do you want me to try to close the breakout rooms?
Yeah, it won't let me close the rooms. I don't know
Okay,
why.
I'll close all the rooms.
All right,
Close them
thank
on-
you.
Yep. And now it says it'll give people 120 seconds.
I've never had this issue ever.
No problem.
That worked. It was great. We were able to leave.
I'm not the, it let me make the breakout rooms. It's crazy.
Okay, is this the group? Are we waiting for others? Oh, more people. Okay, great.
Yep, just a few more. Okay, this should be everyone.
Okay. So I guess the facilitators, Lily, were you a facilitator, Nan, as well? If we could just share a little bit about what we gathered from the group. I can go first. In my room was Anne, Asia, and Allison. Learned so much, and we all sort of wear many hats and come from various perspectives and unique ones. So, so firstly, we talked about some of the programming that exists, such as Eagle Essentials, which is supporting with food security for students. And also the wish list to think about how do we do more events on campus and think about self-care and connect students to insurance coverage and making more awareness about the things that exist. And we all sort of agreed when we look at sort of Maslow's hierarchy of needs, this is tied to that. We can't do this work without meeting the basic needs of our students, and we have to also start there and think about what's sort of where the gaps. One of our members sort of is wishing for a centralized area that encompasses all life skills. I think we're all sort of wishing for some of that. So it's not just the burden of our clinical and health staff, that it's sort of all over the campus and it's centralized and really focused on the attention of meeting all student needs and looking for more funding. And I think, also looking to outside resources. JED has been a sort of a helpful source for schools, but the SAMHSA suicide prevention grant are having one staff allocated to supporting financial well-being, and one school's doing a financial wellness fair. So we'll be really excited to hear about that. And it could be a good model for our other schools here to join in and learn more about. And also talking about how do you do an inventory of your life skills, what exists, who attends, are students learning, what are the outcomes? And one school is focused on conflict management and interpersonal skills. So really great work, but also ways that we can keep moving the needle in this area. So thanks, team. Hope I got it right. If you have anything to add, please weigh in. All right, next group.
I can share for our group. We had U of L, Murray State, UK, and KSU in our room. Really great conversation. Some of the cool things that we're focused on included a new health promotion center, really focused on life skills, that recently transitioned to being underneath the Dean of Students purview. I think where there's going to be a lot of connection to other similar type programming and priorities. And also a concern center, that's an online kind of easy to search, find resources for the broader campus and community connected to all issues, but life skills certainly is an important part of that. We talked about kind of really focusing on some special populations and their transition into our institutions, such as our veteran population, and how even though, they've have tremendous life experience and a lot of skills that still navigating the higher education institution. There's a lot to support, a lot of support to be provided. And that, you know, really exists in maybe more of a target population, like as there's a center for first generation students, or, you know, other centers that are really kind of dedicated to supporting a population of students with some of those life skills and transition support. We learned about some common workshops that exist around like Road to Resiliency, as well as a new Center for Financial Wellness, or kind of a department or area dedicated to financial wellness on one of our campuses. And that department, I think, has a pretty big scope of work. And so really it's, you know, that institution is flagging this is a priority for us, you know, that we're building up the financial wellness and literacy of all of our students. So that was really neat to learn about as well. We also just talked about how this is a pervasive issue for the majority of our students, not just a small number, and that we are thinking about, we already incorporated into orientation or into our 101, you know, courses, but our students tuned in, do they remember when the issue really arises? So is it an effective proactive intervention or not, you know? And so trying to think about how do we provide both the proactiveness that we're looking at, as well as the information to the majority or all of our students, because everybody can use this kind of information, versus just kind of waiting till folks are in crisis. And then they are reaching out, but the person that they trust to reach out to may or may not know all of the answers or where to go to find them. So, but really good discussion in our group. And if anybody wants to add more, please do.
Okay. Phyllis, how did your group go?
Yeah, we had a good conversation, but you know, I feel like I missed some questions. What y'all are saying right now, I don't know if the guiding questions that we hit upon went that deeply. So I'm just going to share a little bit of what we talked about as it relates to those. So in terms of, you know, thinking about the moments and the interactions that we have with our students, and how, you know, if students have ever come to them to ask for advice and different things like that. Not so much advice, maybe, but I love how, I'm sorry, I had Gary and Brianna from Bellarmine, Carrie at OCTC, and Amy at NKU. And they talked about how students do approach them and come to them for other types of support. And it could be one or it could be many, but I love, you know, I'm just kind of reading into that, thinking about how this relationship rich education, that's a book, by the way, coming to a Student Success Summit near you later. But it makes me think about the great working relationships that they have with their students on their campuses, where they feel comfortable to come and talk about finances and credit, and just getting the basics around, you know, can you just help me reach out to this professor, you know? And some of these things I know our students have to be like, who do I trust? Who can I go to? Who? And I even wanted to shout out Bellarmine, because my daughter's a junior there, and she's told me over and over again that she's enjoyed the services that she's been able to have as a result, you know, of that connection, you know, if you will. So that was the first question. The second one, we kind of delve a little bit into, did you feel equipped to support students in those ways? Whatever it is that they bring to you, how do you feel about all that? So yes, there's a huge level of comfortability here. We're talking about seasoned professionals too, but you never know what the students are going to bring to you, right? And let's see, what else did I have here? Oh, and that the fact that when students approach them, and you all kind of chime in too, when you meet with your students, you know, it's impressive that they've already kind of exhausted a lot of the possibilities, but feels like there could be more. And you're that person who can maybe help me with a little bit more. And so I love that one. And the last thing we kind of talked about, let's see, the question was, what do you wish your school offered students to develop these life skills? And, Gary was very specific about financial wellness. And I think we all kind of, sit in that space. And I know there's a lot to unpack there, but it sounds like a theme that continues to come up. And I know it's a factor as it relates to mental health and wellness too. But yeah, we had got to know each other and had some pretty good conversation. Thank you, team. Do y'all have anything else to offer, or has something else come up?
I would just say that something that we're working on doing a better job of is going out to the students rather than waiting for them to come to us,
Yes.
which is more intimidating, I think, and as Amy put it, vulnerable. So we're trying to find more innovative ways to go to them and do it peer to peer.
Yes, thank you. And that's our group.
Excellent. Great. And hey, if you have things that you're doing on campus, like web links, resources, you put them in the chat. We could kind of borrow from that and share good practices. So thanks, everyone. All right, here's the hard part, getting back to the slides. 1 second. Okay, moving on. Connectedness. And this all ties in. We're talking about it basically in every domain, belonging. A lot of the skills will really transfer over. All right, so what do we mean by social connectedness? Well, we looked at some updated stats, and believe it or not, Americans spent about 20 minutes a day in person with friends in 2020, down from 60 minutes daily nearly 2 decades earlier. The loneliness epidemic is hitting young people ages 15 to 24 especially hard. And the age group reported a 70% drop in time spent with friends during the same period. I don't think we're surprised by that. And a lot has changed over the last few years, and the way we connect has evolved. And obviously the impact of social media has been extreme and has been a gift and also been hard at the same time. So we believe that schools really should focus on fostering a supportive social relationships for our students and with one another. We need time to connect. I mean, even in our breakout rooms, just talking about the shows we're binge watching, that's a way to kind of relate and seek new shows that we haven't, watched yet. So again, I think this is very meaningful and very important to our work. Creating a connected campus environment and enhancing programs that encourage tolerance and inclusiveness. So, and we really want schools to analyze student data, look at campus surveys, and look at who's isolated or disconnected. Who are you missing from the conversation? Someone mentioned veterans. Lily, you mentioned veteran students. That's a group that we have a lot of resources often for, but also some lacking. So what do we do about that, and how do we kind of label and name that? So here are a few of our recommendations through JED. And again, this is what I'll want you to consider when you go into the rooms, but providing physical spaces on campus. We lost that in the pandemic, but how do we think, again, strategically, creatively? Who needs to be thinking about the spaces indoor and outdoor to promote social connectedness and inclusion? Peer support programs, and notice I didn't say peer counseling, peer education, peer support. It really looks different at all sort of settings. How do we define that? How do we put training? How do we label? How do we centralize? JED has a ton of resources on that, so you don't have to feel alone in sort of any of these pillars, but good to be thinking about, like, does that likely exist on your campus, or maybe someone's doing it, you want to learn more? Good to kind of ask some of those questions. Connections to community-based religious, cultural, and national groups, where does that live? And do you know about them? Providing training on diversity and inclusion, that's come up. Identify and connect students who may be isolated, like where are they? Are they part of these conversations? Employee specific, population specific support to our greater risk of being lonely, and hiring practices to promote recruitment and retention of diversity for faculty, staff, your clinical staff, et cetera. So I've been following, I don't know if you've seen the US Surgeon General has been doing these Made to Connect tours. And if you just kind of Google it, you can see sort of where he's been and meeting with campus communities, students, stakeholders. But I like this. It's really simple. It's how do we ask for help? How do we accept help and lean on each other? And there's a challenge that they're doing, but also this little, sorry, it's maybe small, but just a quick little thing you could do in the classroom, outside the classroom, how I connected today, how the connection made me feel. Looking inward, who are the people in my life? Who is supporting me? How am I supporting them? I think it's just like these are quick little nuggets you can bring back to your campus. Morehead State University has the Dreams program, which I'd love to learn more about, but something we saw in our search. But really making friends, connecting with a mentor, developing your leadership skills, like this is awesome. So could something like this work on another campus here? Is this how you would title it? What can we learn from one another? And what does it look like? How many students participate? Where are these students now after they've graduated? What have they gone on to do? Are they in similar fields like this? Are they mentoring others? I think this is part of the dialogue we need to be having. And then Project Connect, one of the folks that we work with out in the field, they started this, and we have free webinars for that platform, but helping schools think about bringing connectedness to the students on campus. And I love this friendship self-assessment. It's new and it's free. And again, looking at we talked about life skills inventory. You could do a friendship inventory, and you can do it in different pockets of your campus. But again, where does it live? Who owns it? How do you centralize? How do you systematize? All those things. And you will have the deck after this, so you can borrow it yourselves. Okay, we're going to do another breakout room, and we really want to, try to mix it up. Again, tell us what book or show you're binge watching, and tell us about your students. Are they socially connected? How do they experience belonging? What do we mean by belonging? That has a lot of definitions. Where do they connect on campus? Like, you are the ones that know, right? Not us. How would you describe your campus community? What are the spaces like? Do they exist? Did they go away? What would you change? And what do you wish your school offered as it relates to belonging and connectedness? Okay, so we'll do the same thing. Thanks, everyone, and happy talking.
Nan, can you broadcast those questions into the chat after we're all in our rooms?
Sure.
Okay, thanks. And I'll join room 3 now.
Nan, do you want me to send them in the chat for you as
That'd
well?
be great. Yes.
Sorry. No worries.
You want 12 minutes again? Or
Yeah,
15?
15. I think we're good.
I don't know why it wouldn't let me close the rooms. I don't know why.
No worries.
That's never happened. Thank you.
No worries. Let me send it to you right now.
Okay.
Can you see that? And then yeah, you can.
Yeah.
Okay,
Okay.
thank you. See you
Sure.
soon.
Okay. Shit, where did it go? Fuck. Shh. Where did it go? Where a stupid mouse?
off, Anne. You just were about to share an amazing light bulb.
Share it with us now, Ann.
I honestly can't remember what we were talking about. I was about ready to start
Oh, God.
texting
It's almost
or
Friday.
messaging and saying, "Can I have your idea?"
Okay, so I'm changing this up instead of us telling you all what we heard. And I had the last activity for you to do independent work, kind of adding to what we just talked about. But I'd really love to open it up to hear what you discussed, what you came away with, ideas from your colleagues, what you really want this group to know around enhancing belonging and connectedness. So it's open until time's up.
Well, can I volunteer to Muriel to make a really cool point about just overall what you're seeing? Because that was, I think that's going to be, all of us are going to be head nodding when you say this. So go ahead and speak about that social disconnection.
Sure. So I had shared that I came from community mental health prior to higher ed, and I had some assumptions, particularly with a campus this size, that students would be more connected. And the overwhelm, my first 6 months, 3 months here, I was just sort of overwhelmed and taken aback by the number of students coming in, the counseling center, addressing concerns around loneliness, isolation, depression, feelings of not belonging, and I really didn't understand. And again, some of that was my own assumptions that maybe also didn't match my college experience also, right? So there's that piece. But as I started to understand, like, what is this? How is this a phenomenon here? Then sort of, getting some education around the technology pieces. And again, that hasn't gotten better. As I mentioned in my group, just observationally, going into any large dining hall, there's lack of connectivity. I can just see it if you walk around campus, everyone's sort of in themselves, creating barriers for interaction with folks, again, via technology. And so then I started to understand that a little bit better as to one of the aspects of what's contributing to loneliness, isolation, and feelings of disconnect. So I'm not going to lay it all at technology's feet. However, that is what I observed as a pretty large component. And I do think that we could benefit from some campaigning around that cultural shift in messaging on that. And then also just creating a culture of belongingness in spaces where people do feel a true sense of belonging, particularly marginalized identity folks who I've gotten some feedback don't feel as connected even to folks that share some of their marginalized identities. So it's a combination of things, but just to speak to the social isolation, it was a real culture shock for me and having to change some of my assumptions of what it would look like coming into higher ed, particularly with a campus this size. Creating spaces for connection. Oh, so that was it. Thank you.
Yes, thank you too. Can we keep going with our group?
It's open.
Okay. William, the point that you made around, well, the only thing I could think of in my head when you were talking was this new generation of on-campus commuters. Yes, I just made that up because that's, when you explain that, I'm like, oh my God, okay. Do you mind quickly sharing what you?
No, it's just a lot of what we're seeing, especially post-COVID, is we have students that will get up, go to class. If they're an athlete or they're in the band, they'll go to practice and they'll go right back to their room. And they'll play video games or they'll sleep or and that's the only time that you will see them is they will. And so it's like you said, they're commuters. They're not they might be on scholarship to do something as a musician or an athlete, but they're not involved in anything else. And so they're not really connected because the only people they interact with are their teammates. So they're not connected to anything bigger on campus than that. Like I said, they go do what they got to do. They go straight back to their room. And I've seen more and more of that post-COVID.
Thank you.
Yeah, I'm going to break protocol and just jump in to agree with what the last two folks said. One of the observations I shared was that in our orientation session, I was observing in the back, so it's a new session. It was about like bystander and diversity, equity, inclusion, and a little bit about, anyways, it's kind of like about connections. And it was a long session. It was people were like sitting in the chairs, listening to people talk, right? Which feels like it was good content. It was an old school model. And we paused for 15 minutes because it's a longer session, and all new people, like their brand new world that they're so excited about. Not a single person like turned to the person next to them. Every single person took out their phone for that 15 minutes and like messed around on their phone. It's just, I think we've been thinking we have like the model that I feel like would be endorsed as the model, where we have students in cohorts of 15 students and they have a peer mentor that like a sophomore through senior who goes with them through the orientation, but they get a lot of information at them. But it's really, I feel like we need to figure out how to help them make those early connections, because we'll get people late in the semester, and they don't know a name. They don't know a person other than they just go to class, like you were just saying. And it's, I don't know. And they're living in loneliness and we're residential. We're like 98% residential. So they're living together, they're eating together, they're going to classes together, but somehow there's a disconnect in the connection. Absolutely, about anxiety and about technology and about skill deficits from COVID. I feel like all of it is compounding, right?
Yep. We also talked about spaces for LGBTQ students with disabilities. Like, again, where are these populations? Who's struggling the most? How do we support them? And is it creating a new space, or is it thinking differently? What is it?
No, we just had sorry.
Go ahead.
I was just gonna say we just had a workshop for Latina students. No, I'm sorry, Latina students, and it was like led by a Latina woman or Latina woman, and it was like partially in Spanish, and a lot of sophomores and juniors and seniors. And this is a small campus, 1,400, and a lot of students hadn't met each other. Like that small of a community on this campus, and we're not creating like junior year and you haven't met some of these other folks on this campus. I feel like we got to own some of that, right?
Yeah. Well, we are at time. We had so much fun, right? Thanking everyone so much for, your honesty, openness, participation, support for one another. This is what this work is about. Really appreciate your time, and I'll pass it to you, Lily.
Yeah, thank you all for being here. We'll follow up with the recording and the presentation and look forward to seeing you at the next meeting in 2024. Have an awesome holiday. Bye, everyone.